Good morning, everyone. This is Mary Lobi Entoc, and I will be discussing about school health and school feeding. Even when quality schools, textbooks, and teachers are all provided, children can only receive effective education if they are in school and prepared to learn. Poor health and hunger both reduce attendance and hamper learning in school. School health and school feeding, or SHSF, programs can help overcome this barrier to learning for all, especially among children and youth from poor households who are most likely to suffer from health and nutrition problems. Saver School Health and School Feeding documents and analyzes school health programs for children of school age and helps government strengthen this program. Okay, now first, let's define what is school health. So, school health is the programs here that help link the resources of health, education, nutrition, and sanitation sectors in infrastructure, which is the school, that is already in place, is pervasive and sustained. The conceptual framework in Saver School Health benefits school health programs. School health is the key aspect of ensuring the success of the learner, based on the main elements of the World Bank Education Strategy for Basic Education, which identifies three key objectives for intervention at sequential stages in life cycle of a child. First is to ensure that the children are ready to learn and enroll on time. Second is keep children in school by enhancing attendance and reducing dropout rates. The last objective is to improve learning at school by enhancing cognition and educational achievement. Saver School Health and School Feeding is premised on the evidence that interventions to improve health and nutrition avoid hunger and contribute to these three objectives. What is school feeding? School feeding is defined here as the provision of food to school children. There are many types of programs that varies in countries to countries, but mostly they can be classified into two main groups based on their modalities. The first one is the in-school feeding, where children are fed in school. The other one is take-home rations, where families are given food and their children to attend to school. In-school feeding can be provided into two common categories: programs that provide meals and programs that provide high-quality biscuits or snacks. In some countries, in-school meals are combined with take-home rations for particularly vulnerable students, including girls and children affected by HIV, to generate greater impacts on school enrollment and retention rates and also to reduce gender and social gaps. In relation that of school feeding in our country, which is the Philippines, we have the SBFP, or the school-based feeding program, okay, that varies or usually taken place by its school. Every school, the Department of Education, through the Bureau of Learner Support Services, School Health Division, maintains its commitment to provide good nutrition to learners amidst of the COVID-19 pandemic. So we have here that in the Philippines, the school-based feeding program. Okay, this is to address the hunger and encourage learners to enroll, contribute to the improvement of their nutritional status, provide nourishment for their growth and development, and help boost their immune system, and enhance and improve their health and nutrition values. So, ang maka-avail na dani the SBF, these primary beneficiaries shall be the incoming kindergarten learners and the grade 1 to grade 6 learners who were wasted and severely wasted based on the previous school year. Why do countries invest in school health and school feeding? Children are at the center of the efforts to achieve learning for all. To achieve this goal, it is essential that the poorest children who suffer most from ill health, poor nutrition, and hunger receive additional support in school that helps them to overcome this disadvantage. So school health and nutrition programs can contribute to improve learning and become part of the national development policy worldwide. A pervasive school system provides a platform for delivering simple health intervention for school children, and schools are among the best institutions to reach most adolescents almost on daily basis. So SHSF programs are therefore well placed to contribute to adolescent health and development. In cost-benefit analysis, school health programs often compare with many other educational interventions. These programs have the additional advantage of optimizing the benefits of education already being offered in poor children and are often remarkably in low cost. What challenges exist? Common health conditions affecting school-age children also affect their education. Malaria and worm infections can reduce enrollment and increase absenteeism, while hunger and anemia can affect cognition and learning, thus exacerbating the problems of even those children who do go to school. The pain associated with tooth decay and diarrhea and respiratory diseases associated with poor hygiene may also frequently affect both attendance and learning. Major health conditions that affect education are highly prevalent among poor school children. Hunger also affects learning and attention. What is SABR school health and school feeding? Using new diagnostic tools and detailed policy information, the World Bank Group System Approach for Better Education Results, or SABR, platform collects and analyzes comparative data and knowledge in education system around the world and highlights the policies and institutions that matters most to promote learning for all children and youth. SABR data gathering and analysis are organized by domains or the areas of education policy making within an education system. These currently include levels of education, which comes with early childhood development, primary and secondary, workforce development, and tertiary. Types of quality, resources and supports. Here include school finance, school health and school feeding, and teachers. Areas of governance, engaging in a private sector and school autonomy and accountability. Information sources that includes education management, information systems, and student assessment. Giving complementary inputs and cross-cutting themes like equity and inclusion, information and communication technologies, and resilience. So SABR aims to give all parties with stake in education results, from student, administrators, teachers, and parents to policymakers and business people as accessible, detailed, objective snapshots of how well the policies of their country's education system are oriented toward ensuring that all children and youth learn. SABR SHSF tools collect and analyze and disseminate comprehensive information that SHSF policies around the world. The overall objective is to help countries design and effective policies to improve their education system, facilitate comparative policy analysis, identify key areas to focus investment, and assess in disseminating good practice. Sabre SHSF diagnostic tool can be used to determine the country's progress in implementing each indicator and provide snapshot of the developmental status of school health policy in the country. Although school feeding is one of the components of a broader school health program, the cost and scale of school feeding are much greater than other school health program components. For this reason, a separate rubric framework, which will be discussed later, has been developed for assessing school feeding policies. Here are the actors of school health and school feeding. First is the other relevant governmental or non-governmental stakeholders. Another is the Education Ministry, school teachers, students, and administrators, Health Ministry, local school community including the parents and other community members. The core of the SABRE process is the SABRE Framework Rubric. The framework rubric identifies the core policy goals, which are the core areas of focus for school health and school feeding programs. In addition to the core policy goals, there are policy levers, which indicate program towards achieving the strategic goal, linked to each policy lever in a set of indicators that a government can take or improve its policy framework. For each indicator, there are 4 stages of development that have been identified and standardized. These 4 stages are latent, emerging, established, and advanced. When we say latent, is a very little policy implementation. And emerging, when we say emerging, policy implementation between levels of latent and established. So it's between latent and established. Another is the established, minimum policy implementation, and advanced, implementation of comprehensive policy framework. Advanced here is the most or the high standard. What matters in school health? SABRE School Health has identified 4 policy goals in line with the 4 pillars of FRESH framework. To enable governments to identify the link between policy and programming, SABRE School Health has identified a set of policy levers. These policy levers reflect leading indicators of policy development in each of the 4 core policy goals of SABRE School Health. Linked to each of the policy lever, linked to each of the policy levers is the set of indicators that governments can take towards establishing a strong policy framework for SABRE School Health. Each of the policy levers, together with the indicators, have been developed on the basis of international consensus on best practices in the school health policy, theoretical underpinnings, and evidence based on school health. So here are the policy goals for school health. There are 4 policy goals: health-related school policies, safe, supportive school environments, school-based health nutrition services, and skill-based education. Each policy goal has its policy levers. First policy goal in school health is health-related school policies, together with its policy lever, which is the national level policy that addresses the school health, coordinated implementation of a national level policy that addresses the school health governance and the national school health policy, quality assurance of program, gender mainstreaming in the national school health policy is integral part of developing an effective school health programs, because it provides an opportunity for national leadership to demonstrate a commitment of school health programming and ensure accountability of the quality of programs. An effective national school health policy can help the government develop strategic vision for school health and encourage program ownership. The policy should have a multi-sectorial approach to encourage cooperation because school health is relevant to many sectors including education and health. Second policy goal is safe, supportive school environment. Together with this policy lever, which is the physical school environment and psychosocial school environment. This includes access to adequate water and sanitation facilities, as well as the healthy psychosocial environment. Safe water and sanitation practices contribute not only to obvious health benefits but also help girls' attendance rate. A school administrator that strives for a positive psychosocial environment by addressing issues such as bullying, violence, and other stigmas has also shown to be consistently related to student progress. The third policy goal is the school-based health nutrition services. School-based health and nutrition services together with policy goal or policy levers. School-based delivery of health nutrition services and school-based screening and referral to health systems. These diseases that negatively affect school children's ability to learn, such as those caused by worm infections, are highly prevalent worldwide, especially among the poor. These diseases, many of which are preventive and treatable, impacts the children assistance rates, cognitive abilities, and physical development. This makes screening for health problems imperative along with the treatment of parasitic infections, weakly iron deficiency anemia, and other simple but effective treatments are relevant. Intervention can also include psychosocial counseling and school feeding. Health and nutrition interventions delivered through school systems can be highly cost-effective because schools have the infrastructures to serve as a platform to deliver simple health treatments and provide screening and referral services. And lastly, of the policy goal in school health is the skill-based health education. So, together with its policy levers, which is a knowledge-based health education and age-appropriate and sex-specific life skill education for health, this skills-based approach focuses on the knowledge, attitudes, and values that impact the long-term behavior and choices of school children. A skill-based health education is essential to mitigating social and peer pressure, addressing cultural norms, and discouraging abusive relationships. Psychosocial, interpersonal, and life skills can strengthen students' abilities to protect themselves from health threats and adopt positive health behaviors. A skill-based health education programs can include curriculum development, life skills trainings, and learning materials on subjects such as HIV. Okay? All of these policy goals and policy levers through to its outcome, which is the healthy child are able to learn better. Okay, that's for the school health. Another is what matters in school feeding. So, what matters in school feeding is the health and nutrition services. The school feeding subsystem is given this separate prominence because of the relatively high cost complexity of this intervention. The policy goals of school feeding are the 5 standards of rethinking school feeding according to Bondi and its researchers or co-researchers from Peace Research in 2009. As with safer school health, in each of these policy policy goals and policy levers have identified, policy levers are subdivided into indicators to help governments to create steps towards achieving effective and sustainable school feeding program. So, the evidence-based theoretical underpinnings and international consensus that form these indicators are detailed below. So, here are the policy goals and policy levers of school feeding. There are 5 policy goals, namely is the policy framework, financial capacity, institutional capacity and coordination, design and implementation, and last is the community roles reaching beyond school. Now, let's discuss the first policy goal of school feeding, which is the policy framework, together with its policy levers, overarching policies for school feeding in alignment with national level policy. This is a solid policy foundation that strengthens the school feeding program sustainability and quality of implementation. National planning for school feeding as part of the country's poverty reduction strategy or other equivalent development strategies conveys the importance of the government's places in school feeding as part of the development agenda. For most countries that are implementing their own national programs, school feeding is included in national policy framework, just like we have the school-based feeding program. Each schools may vary, but it is national. Okay. National implemented. It varies in different divisions siguro. The second policy goal is the financial capacity. Together with its policy levers, the governance of the national school feeding program through stable funding and budgeting. This stable funding is prerequisite for sustainability. However, where need is greatest, programs tend to be the smallest and the most reliant on external support. Funding for these programs can come from a combination of sources such as the non-governmental or NGOs, non-governmental organization, and government. When a program becomes nationalized, it is need a stable and independent funding source, either through the government core sources or development funding. In a long term, a national budget line for school feeding is necessary for an effective and sustainable program. Okay. The third policy goal for school feeding is the institutional capacity and coordination, together with its policy levers, which is the school feeding intersectoral coordination and strong partnerships and management and accountability structures, strong institutional frameworks and monitoring and evaluation. These school feeding programs are better executed when the institution is mandated and accountable for implementation, such as the program. Effective program also includes multi-sectorial involvement across education, health, agriculture, and local government, as well as the comprehensive link between school feeding and other school health or school social protection programs and established coordination mechanism. Fourth policy goal in school feeding is the design and implementation, together with its policy lever, which is the quality assurance of programming, targeting, modalities, and a needs-based and cost-effective procurement design. In order to maximize effectiveness, school feeding programs should clearly identify country-specific problems, objectives, and expected outcomes. The country's context and needs should determine the program's beneficiaries, like food basket, where we have the menus, food modalities, and supply chain. Countries and partners should work towards creating a delicate balance among the international national and even local procurement of food for or to support local economies without jeopardizing the quality and stability of food supply. And the last of the policy goal for school feeding is the community rules reaching beyond school with its policy level, strong community of participation, accountability, and ownership. School feeding programs that are locally owned incorporate contributions from local communities and respond to specific community needs are often the strongest. These programs are more likely to make a successful transition from donor assistance to national ownership. Community participation should be considered at every stage rather, without overburdening community members. Okay, all of these policy goals and policy levers result to healthy children that are able to learn better. Okay, that's all for what matters in school feeding with its policy goals and policy levers. How is safer school health and school feeding help to improve educational system? So safer school health is support the government in their efforts to improve education results by providing a comprehensive framework that is discussed already based on a thorough review of the global evidence and related diagnostic tools. Second is by assessing countries to better understand where their policies and programs stand in comparison with good practice, as well as to diagnose where the strategic focus of improvement should lie. And third is by aiding countries to respond to the diagnosis of the problem and develop a strategy to improve their school health programs. Now, how are the countries and partner organizations using safer school health and school feeding to improve system effectiveness? It is by safer used as a platform for involvement of other key donors, key international and national NGOs. In this context, it helps countries identify strengths and gaps in school feeding related policies and system in a country, and even the areas where each player can contribute without duplicating assessment or capacity building efforts. And many of the countries may have implemented SAVER, usually require assistance in drafting a school feeding policy, revising existing manuals and system, or undertaking cost assessment exercise. Some countries have visited the World Food Program or the WFP, World Food Program or the WFP, which is the Center of Excellence in School Feeding, and to further develop the comprehensive action plan for the national school feeding program. So many will be asking for World Food Program. So World Food Program here is the largest humanitarian provider of school meals worldwide. It is implementing SAVER for school feeding intervention. Its current strategy states that as of 2015, all countries that is intended to implement school feeding programs with the World Food Program support must undertake a SAVER analysis for school feeding. In 2015, the WFP and the World Bank Group piloted the use of SAVER tools in 7 countries around the world, and the WFP has subsequently used these tools in Latin America, Asia, and Africa. And last, school health and school feeding partners. This is an initiative collaboration between the World Bank Group, the World Food Program, and the Partnership of the Child Development, which reflects the high level of commitment of this institution or organizations to support and promote school feeding and school health policies and institutions around the world. The Australian government's Department of Foreign Affairs and Trade, or the DFAT, is also a strong supporter of SAVER and education system research and has done so much work to support the application of SAVER globally. So that would be all. Thank you. That ends my report. Thank you very much.